If you have diabetes, managing your condition is crucial. But did you know that some medications can lead to nerve damage, known as neuropathy? This is especially important for diabetics, as neuropathy can worsen your overall health and quality of life. In this video, we'll explore 10 common medications that may cause neuropathy in diabetic patients and provide practical steps to mitigate these risks. Number 1. Chemotherapy agents. Chemotherapy agents like vincristine, cisplatin, and paclitaxel are used to treat cancer, which can sometimes co-occur with diabetes. These drugs can lead to peripheral neuropathy by damaging nerve cells, causing symptoms like numbness and tingling, which can exacerbate diabetic neuropathy. If you're undergoing chemotherapy and have diabetes, it's essential to monitor any changes in sensation. Remedies include dosage adjustments, switching medications, or incorporating physical therapy. Discussing all possible treatments with your oncologist can help maintain nerve health alongside cancer treatment. Number 2. Statins. As we continue, please subscribe to this channel if you're finding this video helpful. Thank you. Statins, commonly prescribed to lower cholesterol, can sometimes cause neuropathy. Medications like atorvastatin and simvastatin have been associated with muscle pain and nerve damage, raising concerns for diabetics who may already have nerve issues. If you're taking statins and notice increased tingling or weakness, consult your doctor about your symptoms. They may suggest alternative cholesterol-lowering strategies or dietary adjustments. Incorporating heart-healthy foods rich in omega-3 fatty acids can support overall cardiovascular health while effectively managing cholesterol levels. Number 3. Antibiotics. Certain antibiotics, like metronidazole and fluoroquinolones, for example, ciprofloxacin, may lead to neuropathy, particularly concerning for diabetic patients. These antibiotics are effective in treating infections, but prolonged use can result in nerve damage, which can worsen existing diabetic neuropathy symptoms. If prescribed these antibiotics, be vigilant about any changes in your sensation. If you experience symptoms, consult your doctor immediately. Exploring alternative antibiotics and incorporating nerve supportive supplements like alpha-lipoic acid could help mitigate these risks. Number 4. Diabetes medications. While medications like metformin and thiazolidinediones are effective for managing blood sugar, they can also lead to vitamin B12 deficiency, which is crucial for nerve health. Symptoms of deficiency include tingling and numbness, common among those with diabetic neuropathy. Regular blood tests to monitor B12 levels are vital. If deficiencies are detected, vitamin B12 supplementation can help, and incorporating B12-rich foods such as eggs and dairy into your diet may support nerve function while managing blood sugar effectively. Number 5. Opioids. Long-term opioid use for chronic pain management can exacerbate neuropathy, particularly concerning diabetics. While opioids provide effective pain relief, chronic use can result in increased nerve sensitivity and damage. If you're on long-term opioid therapy, collaborate with your healthcare provider to explore alternative pain management strategies. Non-opioid options like physical therapy or acupuncture can reduce reliance on these medications. Additionally, consider incorporating natural anti-inflammatory foods like turmeric and ginger to support overall nerve health. Number 6. Anticonvulsants, like phenytoin and lamotrigine, are often prescribed for diabetic neuropathic pain, but can sometimes lead to further nerve issues. While they help manage nerve pain, they can disrupt normal nerve function and cause additional symptoms like tingling or weakness. If you notice these side effects, it's important to discuss them with your healthcare provider. Adjusting the dosage or exploring alternative treatments can help. Incorporating non-pharmacological therapies, such as cognitive behavioral therapy, may also assist in managing pain without worsening neuropathy. Number 7. Heart medications. Some heart medications, particularly amiodarone, can cause peripheral neuropathy as a side effect. For diabetics, managing heart health is crucial, but these medications may lead to nerve damage, causing symptoms like tingling in the limbs. If you're experiencing these symptoms, consult your cardiologist. Adjusting your medication or exploring alternatives may be necessary. Maintaining a heart-healthy lifestyle, including a balanced diet and regular exercise, can support both cardiovascular and nerve health. Number 8. Psychiatric medications. Certain psychiatric medications, especially nortriptyline and duloxetine, can lead to neuropathy. While effective for managing depression and anxiety, these drugs can interfere with nerve function, resulting in symptoms like numbness. If you experience these side effects, talk to your psychiatrist about adjusting your treatment plan. Incorporating lifestyle changes, such as regular exercise and stress management techniques, can enhance your mental health and potentially alleviate nerve-related symptoms, making them a crucial part of your diabetes management plan. Number 9. Antiviral medications. Zidovudine AZT, used in HIV treatment, can cause peripheral neuropathy, which is concerning for those with diabetes who may already be susceptible to nerve damage. This medication can affect mitochondrial function, leading to symptoms such as burning sensations or weakness in the legs. If you're on this medication, consult your healthcare provider about possible alternatives. Ensuring adequate intake of B-complex vitamins through diet or supplements may also support nerve health, so don't hesitate to discuss this with your doctor. While medications can be life-saving, being aware of their potential side effects, particularly regarding neuropathy, is vital for those with diabetes. If you're taking any of these drugs, don't hesitate to discuss your concerns with your healthcare provider. Together, you can find the right balance between effective treatment and minimizing risks. Remember, taking charge of your health is a crucial step toward overall well-being. And please subscribe to this channel if you find this video helpful. Thank you for watching.